How often have you seen that you get to your weight loss goal only to regain it sometime later? This can be so frustrating. Unfortunately, your physiology plays a big part in this. In fact, we are all wired for weight regain. So why does this happen? Physiologically speaking, when people lose weight, their metabolism may slow down as their body adapts to a reduced calorie intake. This makes it easier to regain weight, especially if you return to your previous eating habits. There are also hormonal changes that occur with weight loss, especially with your hunger and cravings hormones. Unfortunately, you may find that levels of your hunger and cravings hormones increase after you lose weight. This is your body's way of making you regain weight. Besides physiology, there are other external factors that are responsible for weight regain. Things like lack of physical activity. Did you know that most people need at least 250 minutes of exercise weekly to keep their weight off? That's about 50 minutes of physical activity 5 days a week. Another factor is eating too many calories, too many carbohydrates, and not enough protein. Maintenance of weight is not about depriving yourself, but rather it is about creating a good balance between exercise, calories, carbohydrates, and protein. Thus, it is important for you to work with an experienced weight loss provider to formulate a balance that is unique to your needs. So remember, even though weight regain is common, we have many different tools we can use to fight it, but it can be tough to do on your own. If you'd like to team up with my team and I at Physicians Premier Weight and Wellness Center, visit healthymeweightloss.com. We look forward to helping you not only lose weight, but successfully maintain your new weight as well.